Hi, how are you? This is the Mindfully Integrative Show, and this is Damaris Maria Grossman. And today we have an amazing mindful chat with Dr. Jeff Gladd. He is the Chief Medical Officer for Fullscript, which you may know of and may use already. And if you don't, we'll learn more about. And he also has his own integrative medicine practice and is a provider in that care too. So thank you so much, Jeff, for being on the show and hanging out.
No, it's great to be here. Thank you, Damaris.
I really appreciate your time. And, initially I tell people, like, what's a little fun fact that they may not know about you?
Oh, goodness. Fun fact.
Yeah, something, different.
Yeah, so fun is I have a motor home and I live most of my summer in my RV, working out of my RV with my family. So
And
that's
travel.
that's
You
my
travel.
favorite. Yes. So road trips, travel, camping. That's so our life for several summers. My son is a college baseball player now, but the travel baseball scene, we never stayed in a hotel. It was always camping in the RV. So that's my fun fact. I could talk about
Oh,
that
I
for
love it.
days.
So, a couple of years back, I traveled in I wasn't glamping at all at the first time I did it. I traveled in a van and I converted a van into like a queen size, nothing
Yes,
was no shower or anything. And then I was, did that for a whole summer's worth around the country. And yeah, I definitely now I definitely want to glamp it and do more of a high end motorhome. But back then I didn't have that much money. So I was trying to work it out. But oh, so much fun though. My husband doesn't find it as fun as I do, but I liked it.
yeah. Luckily, the glamping part got my wife completely on board.
Oh, if I
And
glamp it, now we might be fine. But
now
like
you're
back
all in.
then, how I did it with like going to the gym showers and, it was definitely not very clean. It was clean,
Yeah,
but it wasn't lovely.
totally, totally.
But it
Yeah,
was
and
good.
with
I had to go
air.
to all the national parks. It's just for us. I mean, I guess as integrative providers, I don't know. I feel like we relate on that because when I talk to another, integrative provider, they're like always wanting to be grounded. So like us traveling and doing things like that, it's like, oh, yep, you get it. Yep, totally.
Absolutely. Well, and you get to do it with your own kitchen and refrigerator, right? And so for integrative practice, like staying on your nutrition plan, way
Totally.
easier in when you're driving your kitchen than if you've got to go rely on restaurants and fast food and gas
Oh,
stations and
that's
whatnot.
a really good point. Yeah. So yeah, for sure, I would definitely go on the glamping side. So
Yeah.
yeah, I definitely would need some tips on that at some point if I. That's cool. So on the summers, that's really great. So when the kids are off from school and stuff.
Yeah, off from school. And then, now it's fall, kids are in school. So we just look for weekends to sneak out and take friends down to concerts and tailgate. And yeah, it's a great like community friend family machine, right? That's kind of why we do it.
Love it. I love it. That's super cool. Well, that also kind of entwines in like where you are in your mindset, especially in the integrative medicine space and integrative health. I'm obviously very passionate about it. You obviously are very passionate about it too. And it becomes something where it's just like we live it, it's part of who we are. And how did kind of this come for you, this journey? Obviously you're a medical doctor, but to change your perspective, not anything wrong with conventional medicine, or it's just, just changing it to a different perspective. How did that change for you? And where was that? What's that story for you?
Yeah, it is this sort of central story of everything for me, right? So our daughter is now 16, and that's our second child. When she was born, I was busy family doctor in a small town, delivering babies, doing the urgent care, inpatient care, 40 patients a day in the office, and just sort of didn't realize it looking back, clearly burned out.
Right.
Was also sort of bordering on obesity from a weight perspective, and had just lived this what I would consider a very conventional life as a conventional doctor. And I even going back to medical school was self-medicating myself with Paxil and Zoloft to manage panic
Mhm.
attacks.
Right.
So looking back was like, gosh, what a perfect study for implementing integrative medicine. That wasn't how I got started. It was to lose weight. And as I
Okay.
did
That
that,
makes
uh,
sense.
you know, felt great, mind opened up, and I lost 50 pounds in 6 months, and it was like, oh my gosh, there's something to this that's super powerful that I didn't know about. Wean myself off of the medication, completely symptom free. And so there was the big aha for me, like, got to learn nutrition, got to learn more about this. Started
Right.
reading Andy Weil books, and what happened was that fall, I was following Michael Pollan, read Omnivore's Dilemma, mind blown,
Yeah.
nutrition path now set, and got an email that Michael Pollan was speaking at a nutrition conference in San Diego. So I was employed by the hospital at the time, canceled my CME money for the American Academy of Family Physicians conference that I went to every year, and said, I'm putting my money toward this. I want to go hear Michael Pollan. And it was the University of Arizona Weil Fellowship Conference.
Oh, cool.
And elevated now 10 levels of, okay, not only is this nutrition, there's an entire philosophy and discipline of practicing medicine, and could never look back.
I can never look back either. I totally.
Yeah, it's
can never look back.
impossible. It's impossible. Applied to the fellowship, got accepted, went to the hospital CEO and said, I want to start an integrative clinic. Couldn't practice the same way anymore. And what the story I tell is, here I am sitting with patients, and it's time to raise the insulin dose, add a third blood pressure medicine, more statin drugs. And it was, hey, what'd you eat this morning? Right. Totally, and what I found was 80% of patients not interested. Doc, give me the drug. I want to get out of here. I'm on short time. 20% of people, like, eyes open, relaxed shoulders, like, oh, like, let's talk about this. And then I would say, oh man, I got 3 people in the lobby and I got 2 people sitting in rooms. Love to have this conversation. I can't. So that was sort of where my mind I have to practice differently, not just philosophically, but from a business of my practice perspective. And so that sort of, over time led me to this journey of where I am today. And now trying to sort of help other practitioners do this through Fullscript, where I can reach a heck of a lot more practitioners and more of those minds who are trying to figure out, like, I get it. I just don't know how to do this. I don't know how to run a practice, and I don't know how to get started with patients.
Oh, I love Fullscript, by the way. I've been using it for a number. I mean, totally. No disclaimer on that. Just the protocols and like some of it just makes sense to me. So there was a lot of other things out there. Like, it gets to the point where, for me as a provider, sometimes I will, go, hey, I want you to do this protocol or I would like you to take this, and then for them to understand why. That's a big thing. The other part is, like you're saying, having the time. At least what I do like is you're trying to at least make it available for somewhat available for the providers that can't give the time, which is at least helpful. That's a start, right? And then for us that we try to give more time, we try to give the more effect.
Well, I mean, and you mentioned before we started the interview, how you've got it interfaced into your EHR, right? So we're fully committed to growing that part of the business, because we know even if you have time, being part of your workflow is really important, right? I mean, even if your visit is an hour, it still feels like it's not long enough. And so, when the average is more like 7 to 10 minutes, it definitely isn't long enough. So how can we be more baked into workflows to make it easier to start delivering integrative medicine?
Yeah, no, and it makes so much sense, because what it is it's like the basic, let's even just discuss the basic lifestyle top 5, right? Or the top 2 for right now: constipation, hydration, and like elimination, or it's like, what are people, that quick stuff, or and I appreciate that women's health and the depending upon the need of a patient. So, and then at least that starts the conversation before I'm even going into further lab testing or further conversation of other things. And it's at least like, okay, what's going on?
Yeah, absolutely. And we've spent a lot of time the last 2 years, thinking about how do we help patients adhere to their plan that their practitioner is creating, and just released a big white paper on behavioral change and how to help practitioners implement behavior change. And it really, like, none of it's like like brand new stuff, but it does help kind of focus us where the plans need to be simple, right? We've got to get patients, just get them started, and not bring in all this complication and make it too busy. That was one of the big takeaways for us in terms of, helping practitioners kind of understand what's going to make the biggest impact for getting patients started. And then now, how do we maintain that journey, right?
Yeah, what I appreciate with your platform and discussing integrated medicine as a whole is, I mean, as a provider and seeing patients, the simpler the better in general. One, you want them to be compliant in general, right? Whether they're integrative or not. So it's
Yeah.
like the simpler that I can say it. That's why I'm always like obsessing over telling someone a mindful way every day. If we can at least do, all right, so you got one extra cup of water today. All right, did we calm down and sit for a minute and not look at the phone? Did you add some magnesium or some sort of fiber in your diet? Like, what's the basic thing that I can talk to you about? And putting that in some of these protocols. I say protocol, but a care plan for people that I don't have to go and write every time. That is
Correct.
helpful. And I'm seeing it on my end. And, I know that you are trying to help individuals in the masses. Like, we're not even talking about probably your patients in your clinic. You're helping and utilizing this for many people. So it's really cool. I mean, to you, how did you even become a chief medical officer of a big company like that? What got you to
Yeah.
that point? Like,
So
that's amazing.
it is, and I love I
You
love all
must
my
feel so
stories, but
blessed. I mean,
totally blessed, totally blessed. And it's a great story for, my kids who are sort of now just starting college and looking at like, how do you create opportunities? And listen, nobody at Fullscript has seen my resume. They don't know where I went to college, right? So you tell my kids, like, just do something you're passionate about and just learn as much as you can, and good things
and work
happen.
hard,
So yeah,
Yeah, it'll
absolutely, right?
happen.
The grit.
Yeah.
That's
Yeah,
right.
the
The
grit.
grit is a
Exactly.
core value at Fullscript. So I created in 2011 after I launched my practice. So I started an integrative practice at the hospital, did that for a year and a half. They wanted me to see 3 times as many people. So it's back to that old school mentality. So I
Yep.
spun off and created my own practice, which we still have now 12 years later. But I built Mitoven. Mitoven is a medication induced nutrient calculator so that you can put in the drugs a patient's on, and it immediately calculated which nutrients are at the greatest risk for being depleted and what are the symptoms of those deficiencies. And so
Is this on
it was
Fullscript? Is this with Fullscript?
so it is now.
Oh
It's a
my God, that
Fullscript.
sounds amazing.
It's a
How did I not know
Fullscript
about this?
product. Yeah. So well, here I'll tell you why, because we're still working on
Oh,
bringing it into the app, right? So
gotcha.
for me, it was this incredibly powerful tool that just made sense. I didn't have a business model around it at the time. It was a labor of love. But
Yeah, of
Kyle,
course.
who's the co-founder and current CEO of Fullscript, reached out to me on LinkedIn as soon as he saw it. And he's like, I love this. I love your vision. I love your ideas. How can we get together? And so we started meeting at conferences, staying in touch. I had done a couple side projects. And so as Fullscript was growing, my practice was really booming. And so it didn't make sense 4 or 5 years ago to kind of make that transition. And but we always said, Kyle would always say, "You're going to be the chief medical officer of Fullscript. You're going to be the chief medical officer of Fullscript." And so as Fullscript, grew and grew, took a big investment, merged with natural partners. He called me. He's like, "It's time. Let's go." And so this was 2019, and at that time, the need was kind of part time, which fit my schedule because I was still my practice was still thriving and was still, really, really focused on clinical medicine. So I did 2 days a week at Fullscript as chief medical officer and 3 days in the office. And then COVID hit. A virtual dispensary became an indispensable part of delivering integrative medicine. And now it's time to start thinking bigger and thinking more than just supplements.
Oh,
And
the
so,
pandemic made it like almost a necessity, I felt.
correct,
Oh, it,
correct.
it was like it was part of the equation because instead of me just giving a million labs to someone, to just have these like real time things that are tangible for someone to understand, and
Yeah,
they're more willing to like, and when I tell them it's safer, and and you're discussing with them, this is the conversation. And um one, you're trying to be real with them and say, hey, let's just say probiotic, right?
yeah.
But that in itself, if you're not going to the right provider or the right lab, you could be getting, I don't know, the off-brand, really bad stuff.
Yeah, no, absolutely.
Yeah.
Absolutely. And so, and another like really valuable, important sort of core value for me is work-life balance. And so what I realized at the end of 2021 is I was living 2 full-time jobs. I was still in the
Oh,
clinic
okay.
3 days a week. In between patients, I'm checking Slack and checking emails for Fullscript and jumping into a meeting. And so
That's a
then it
lot.
just became, I want to be a full-time chief medical officer. I want to help grow this company. I want to move beyond supplements. I want to be the tool for integrative medicine, and I want to help integrative medicine just become medicine. And so
Just become
that's
medicine. Yeah. Just
that's
become
it.
like the normal part of the play. Like this is the
The
normal
standard.
conversation.
Correct. Correct.
I would love
So,
for that too.
yeah, it's a blast working in this company, and just the energy and the passion, and I'm impressed every single day at the team and how they think like the practitioners think and think like the patients think in a way that you thought like, well, you don't even do this. How do you know like what those needs are? But yet they nail it. Now they talk to lots of practitioners. We do lots of surveys. And man, the design and product team is so gifted to be able to take some of these thoughts and ideas and say, we can make this even easier for integrative medicine.
Yeah. I definitely have seen a transition for me as a provider for patients. And I don't know exactly how it maybe it was the integrations. I definitely could see the plans has helped me
Mm-hmm.
because then it kind of cuts down even some of that time frame and just the understanding for those people that are like, oh, is this a bunch of BS or are you really coming up with real stuff? And you're like, no, this is research based. Like this is what is the real medicine, and
Absolutely.
sometimes it's the simple stuff that is the most effective. But I think it's that conversation with someone that these doctors and nurse practitioners provide. We just most of them didn't have the time to talk to people about just to have the and then to have these protocols in there makes it a lot more tangible for them too. So I think it's pretty cool. I mean, I can see
Yeah.
why you're passionate at this, even more with it.
Absolutely. Absolutely.
Yeah.
Right. We even touch on the whole quality story, right? Like there's plenty of places to get supplements, but
Plenty,
you
right?
really
There are.
don't know what you're taking. And
Right.
if I'm going to be a clinician and I'm going to write a supplement prescription for a patient, that should have the same level of quality and effectiveness and reliability and safety as any pharmaceutical I would ever write. And so, listen, if you're not, I tell my patients, like, if you're not going to get it through Fullscript, where I know where it's coming from, you have to be sure you're getting a source that's getting it from these manufacturers. And here are the manufacturers. It's because, again, it's really important for your health and the expectations of what we want to happen with your health.
That makes a lot of sense. Um, do you have a story or a thing that you'd like to add in for the day before we go? Obviously, I want people to reach you, but an additional.
Yeah, I was thinking about this, because I knew you were going to dive into, some questions about my health and help, others and listeners sort of
Well, I mean,
get
in what you
inspired.
like to
But
disclose privacy in your.
oh no, I've given you a lot, so I'm happy to
Yeah,
give you everything. But I would say the one thing that, in my journey, so change nutrition, lost 50 pounds, great.
a lot.
The
Yeah.
thing that really has carried me at this point that I fully rely on is probably 7 years ago, I found a personal trainer in town, and not everybody has access to this, so I understand. But finding ways of working maybe in a group or finding someone online. But I went to this trainer, and we've become really good friends over the years. Matter of fact, he's 2 doors down from my office now, so I work out twice a week. But the schedule and the commitment and someone guiding the heavy lifting so that they're following the numbers and the strength gains, they're following the form. But I've got that appointment. It started one day a week. And then 2 years ago, I said, I need to do this 2 days a week. But having that commitment on my calendar for me personally has been critical, because what I was doing prior to that was, you got back from vacation, I'll get back to it, right? It takes 6 to 8 weeks to get back to the gym. And then I just kind of want to go through the motions today. So you don't really push yourself much. So for me, it's finding a partner. And again, it's been an investment for me that helps push me there. And again, that doesn't have to happen through, a one-on-one personal trainer. There's lots of paths for patients. But I think that the strength training is an invaluable part of health. And I talk to patients a ton about that now. How are you going to gain or maintain strength? And that's in the gym or at home, but it's also in the kitchen, right? Are you consuming enough of the building blocks, proteins, to maintain that strength? So that's my personal best advice I can give, because it's worked incredibly well for me to just maintain this really, really consistent health focus.
That's so important to say that because it's like, your journey kind of will help kind of gain perspective for others, but also just the reality of like our bodies are machines, right? And they're, it's made up of a certain way of how it and proteins are the, the amino acids are, that building block. And when people can see that, these little steps, this little exercise, this little strength training, this relaxation times, is whatever their eating regimens are, when they can just put in one part. It's so important.
Yeah, absolutely. I talk to my patients about, a lot about longevity and health span now. And
Yeah.
and I have them just observe the world, observe the lobbies you sit in and the airport and watch people get out of their chair, right? That's just such a basic element that you think is always going to be there. It's not if you don't invest in the strength side of your body sooner rather than later and consistently.
What overall for, your, like, you're still having a practice, correct? You still do the practice?
I do. Yeah, I'm down to 2 half days a week, but I was able to kind of put my arms around 150 of my patients that I'd seen for a long time and said,
Oh,
I still want to work with you. I still want to be on the front lines. And so I do. I still have clinical time that I value.
oh, that's beautiful. You still give them that's amazing. I mean, I know that must be a lot for you, but you still are able to make the time. But how can those reach you? If they're able to, or I'll have information in the show notes, but how can they reach you and learn more about you and learn more about your company?
Yeah, so fullscript.com is the marketing site, right? So practitioners who are interested can absolutely, learn everything they need to learn about Fullscript there. Sign up for a demo. It's a free platform. So any provider, just take a look at it, just create an account and see how it might work for your patients. But personally, GladdMD.com is my clinic website. And they
Perfect.
can reach me there. I'm on LinkedIn. I'm on Twitter. Happy to
Great.
engage and talk
And
about,
do you have, is it you and other providers in your GladdMD company also?
It is. So my wife is
Great.
one of our nurse
Perfect.
practitioners,
Oh,
and I have a
perfect.
couple other practitioners. Yes.
Awesome. Yeah. So no, I'll put those in the show notes. And then I think it's quite amazing that not only how effective Fullscript is, but you've offered it in a free aspect for people. And that's pretty profound because I think that, I mean, you probably could, in some ways do more, like even more things, but I think it gives it accessible to all of us. And for those people that are not practitioners, how do they find providers that are using this, or how can they use the full script?
Yeah, so Fullscript, we have maintained a relationship and an investment in practitioners, and
Perfect.
so patients will not be able to purchase those supplements
Okay.
on Fullscript. But seeking providers in their area or that have a telemedicine practice,
Gotcha.
oftentimes you can see in their store whether they use Fullscript. There is still good content and good education, the kind of stuff you're sending to patients and
Right.
have been so happy with is available online to patients. None of that's
Perfect.
hidden. So they can start taking their own personal journey and maybe they, kind of end up working with a practitioner to help them go a little bit deeper and then can start to kind of look at some of the supplement plans that are in Fullscript.
That's great. I love it. Well, thank
Awesome.
you so much for being on and for taking your time. I appreciate all of your wealth of knowledge and those listening.
Yeah, thanks for having me. Keep up the great work. Keep putting this message out there. It's incredible.
Thank you again, and I appreciate that. And for those listening, make sure you find a mindful way each and every day and have a good rest of your day.